During the housing recession, when it first started, you started seeing first of all, the complete lack of funding for programs and activities going on in our community. And you started seeing increasing vacancy and increasing blight in parts of the Lower East Side, such that nobody thought anybody would ever come back and want to reinvest anywhere. Of people leaving, and at the same time, you had new industries coming in. You had Wayne County Community College and Mercy Hospital moving into the area. And so there was this change. And the question was, what role can residents play in helping make sure that the changes that are taking place contribute to positive life? So at that time, we got together and we decided we wanted to figure out how to reuse vacant land in the absence of people coming in. And we started with the model that every neighborhood has a future, and that people who are living in the homes and the neighborhoods in this community have invested sometimes for generations in their upkeep, and they have the right to be there. And we were looking at that and also saying, what can we do with the land? And one of the things we looked at was green infrastructure. So when I started as president and CEO in 2016, that's where we had gotten. We had gotten to this idea of green innovation and green infrastructure in our community. Also at that time, we were looking at the fact that there have been storms in 2014 where people's basements and homes have been flooded, and they still had, sometimes still the flood water, black mold, and other toxins inside their homes. And so we started looking at what can we do around flooding to help prevent flooding in our community. We've also looked at air quality and the fact that we have so many polluting industries near our offices, in our community. And then finally, we know that there's a zip code difference, that if you live in one zip code, your life expectancy can be dramatically shorter than if you live in another. So our goal is to address climate health inequities, to try to reduce the gap between protections in the Detroit community and protections in nearby suburbs, but also look at the fact that we live in one climate, one air, one water, and one soil, and so we're all connected. Any poisoning that happens as part of the community eventually ends up impacting the rest of the community, and we don't believe that that is sustainable for the planet, and therefore there's a reason for all of us to get involved in addressing these harms. Resource needs are really significant for a lot of students, and we don't want to lose more students because they cannot afford to continue their education or they cannot afford to continue the internship. When they are serving as interns, that means they're not working part-time jobs or they're not working full-time jobs because they've got to be interns. In addition to all of the debt that they're acquiring while in school, now they also have to spend hours doing work, which will eventually pay off, but not immediately. And so the Blue Cross Blue Shield of Michigan grant will allow us to pay interns much more than we have in the past. And we now have 5 interns who are working with us to address some of the needs, get to know the community, help us with the assessment, but also help us with the curriculum development, working alongside our staff team. I think that the foundation investing in community wellness is a wonderful thing. We think that as customers and as community members, it's the largest insurance agency in the city of Detroit, and we have a shared mission at reducing the burden of healthcare costs on your insurer, because we want people to be healthy.